Why should dietitians care about nutrition policy? Well, I'm here to tell you just a few good reasons why you should get involved. My name is Emily Fielder, proud registered dietitian nutritionist and member of the Academy of Nutrition and Dietetics since 2008. Currently, I practice in an outpatient setting and have seen firsthand the impact public policy has in my practice. Public policy in our profession has the opportunity to really make dietitians stand out as the nutrition experts. Policy in the past has made many positions for dietitians even impossible in settings like diabetes centers, renal settings, SNAP education with the USDA, WIC, and many more. There are so many important policy issues with our profession, but here are just a few most important to me. 1. Improve patient access to dietitians. Right now, there are many people that would love to see a qualified professional to get answers to their nutrition questions, but oftentimes don't due to insurance not covering dietitian services. 2. Career growth. Key policy pieces like the Treat and Reduce Obesity Act getting pushed forward, the more career opportunities there will be for dietitians. And lastly, increase reimbursement. The more insurance covers for dietitian services, the better our salaries will be. Insurance companies often need to see policy pieces in place, but first before making our services a covered benefit. Research shows that dietitians are 2 times as likely to help patients lose significant weight and increase physical activity. Experts agree that dietitians are most qualified food and nutrition experts, according to the Institute of Medicine, MDs, and U.S. Preventive Services Task Force. Remember, we all have a voice. If dietetics is your profession, policy should be your passion.
Well, eating and good food and good health are things that we can all appreciate. Members of the Academy of Nutrition and Dietetics work through food and nutrition to improve the health of families. I'm one of 75,000 members of the Academy. We use many tools to empower people to improve their health, and one of the tools people don't think of is nutrition policy.
It's hard for me to imagine that people don't think about it. You think about SNAP, or you think about the school lunch program, or you think about this epidemic of obesity and what's being done in terms of nutrition labeling and nutrition education can go such a long way for all of us in terms of not only helping people lead healthier, longer lives, but also go a long way in saving healthcare costs. And so you're on the vanguard of the next great public health crusade.
What would be your advice for people who want to work with their elected representatives?
I tell them to get motivated by the facts, Number one, the leading cause of premature death behind tobacco. And we've already fought the tobacco wars. We know that that is a huge public health campaign that needs to continue. But obesity is going to eclipse tobacco as the leading cause. You're critical to it, and that's what I would tell the folks that you work with who say, I don't like politics, I don't like government. I would say, if you want to be successful, you need to look beyond just each individual client, because we need to change the culture in America. And how we do that is we all get on board, and public policy can lead the way.
Hi, I'm Jennifer Doin, registered dietitian with the Louisiana Dietetic Association. I was asked to hold a board position for LDA early on in my career, and my love for public policy began there. Public policy is not only important to the profession of dietetics, but to all who depend on food. I feel that nutrition policy is important for the health of all. Nutrition policy is here to protect, promote, and produce all that encompasses food, nutrition and dietetics, and our economy. As an RD supporting ANPAC, we are securing our future as both a professional and a consumer. So stand with me in sharing our expertise in nutrition policy. If we do not support our future, then who will? I look forward to attending Public Policy Workshop in the spring and learning all that I can about nutrition policy and promoting the profession of dietetics.
Hi, I'm Nancy Becker from Portland, Oregon. We all eat food, and food and nutrition is a hot topic right now. Congress hears a lot about nutrition, and our challenge in the Academy is to get the collective voice of the dietitians heard. The Political Action Committee is a way to increase the impact of our voice by collective action. When each of us donates a small amount of money to the PAC, it adds up. Then, when a congressperson holds an event, the PAC can donate a larger amount than one of us normally would, and we get a seat at the table. Literally, sometimes it's a seat at a small table in a small room. ANDPAC has helped me go to small political events and meetings with senators and representatives and to consolidate our message. After all, we want to be the trusted voice of nutrition for them, right? We want them to know us, come to us, and trust us, and rely on us for nutrition, not other allied health professionals. I had one great experience with this when my senator, Jeff Merkley, called me personally to ask a technical question about the implementation of federal menu labeling in the Affordable Care Act. It was awesome to have a senator ask me for my thoughts. I would never have had this access without the Political Action Committee. Thank you, ANDPAC.
Why is supporting the Academy of Nutrition and Dietetics Political Action Committee, ANPAC, important to the dietetics profession? Supporting ANPAC will help introduce the vital roles of registered dietitians to state and federal representatives. Without ANPAC, some government officials might be unaware of the role registered dietitians play in health, food, and nutrition. This could lead to government officials implementing laws that require other underqualified professionals to do the work of registered dietitians, resulting in a decline in the profession of registered dietitians and possibly misinformed information being circulated about health, food, and nutrition. ANPAC can work with federal and state representatives to ensure registered dietitians are involved in the decisions that concern health, food, nutrition, and disease prevention. Supporting ANPAC will expose government officials to the roles of registered dietitians and how these qualified professionals can help lower the country's healthcare costs through food and nutrition. ANPAC will support candidates for federal office that share the same views and recognize the need for registered dietitians in the healthcare field. Thank you.